Is root resorption a prevalent and severe problem in dental practice? What are the different types of root resorption? Which root resorption is most prevalent, most challenging to treat, and has the worst prognosis? Hello, I am Marwan Abourass. I'm glad to answer these questions. The literature say yes. Root resorption is a prevalent and severe problem in dentistry, clinical dentistry. There are primarily six kinds of diagnoses. Each diagnosis has two or three sub-diagnoses, depending on the severity and location. Therefore, there are 14 potential root resorption problems in dentistry. Did you know that? We learned three or four in the dental school. This is why I have put together this master class. The most prevalent resorption is endodontic resorption. The most difficult to treat is periodontal resorption. The worst prognosis is replantation resorption. Professor Tsaysis and his group evaluated 20,000 radiographs obtained from 712 Middle Eastern patients. They found an overall prevalence of 28%, 71% because of endo, 14% because of ortho, 10% because of pressure third molars, and 39% because of periodontal. This year, February 2023, Dr. Dow in UCLA found a prevalence of 15.7, identified in 1,100 CBCT from 712 patients. The overall percentage pulpal 22%, internal 9%, cervical 29%. And the most important finding was the incidental finding of 31% undiagnosed. And this is a big problem because resorption is asymptomatic. And if you leave it untreated, it will have a serious consequences. The problem is asymptomatic, you know that, and it's very slow in progress. So, according to the literature and clinical experience, the most prevalent problem, root resorption, is number one associated with periapical pathology, apical periodontitis. Number two, invasive orthodontic treatment. Number three, second molar impaction, mesioangular impaction against the second. Number four, periodontal, cervical. And number five, replantation. Of course, there is the systemic one, which we will also talk about. The literature is very controversial on the subject, especially when it comes to definition and classification. I have found 28 different terms that attempts to define root resorption. Heathersay in 2004 cited 14 terms just to describe cervical resorption. Some classifications are anatomic, external, internal, cervical, apical, foraminal, periforaminal. Others use etiology, infection induced, pressure induced, trauma induced, or symptomatology, invasive, chronic, spontaneous, histological terms, inflammatory, fibrous, epithelial, hyperplastic. So, regarding all of that, let's look at you, the practitioner. What do you have? You don't have a microscope. All you have is your x rays, radiographs, and your eyes. And most problems are hidden down into the root structure. So we know today that the best way to define it is problem based, discipline based, endo, perio, ortho, and so on and so forth. So the Abourass Masterclass on root resorption consists of five presentations on five dental disciplines: the endo, the ortho, the perio, the replantation, and of course, the sixth one is the non dental origin. In each one, we'll talk about definition, diagnosis, treatment, prevention. I have gathered all my knowledge, experience, and insight to produce such a master class, focusing on the scientific evidence best practices, and an interdisciplinary approach. The content, of course, has influenced my commitment to the dental student, the general practitioner, the dental hygienist, those dental professionals who sees patients every day. I want to simplify diagnosis. I want to simplify endo, and I hope you share me that vision. Thank you for listening.